Hello, and welcome to Health Action TV. My name is Shirley Torho, and I'm the president and CEO of the National Black Leadership Commission on Health, also known as Black Health. We were formerly National Black Leadership Commission on AIDS. Tonight, we have the pleasure of speaking with Chris Norwood, who is the founder of Health People. Now, Health People is an organization in the Bronx that does work using what we call a community in-reach approach. This means that they use a peer-to-peer model to educate community members about the health disparities that are impacting communities in the South Bronx and largely across New York City and beyond. Black Health has had the opportunity to collaborate with Chris Norwood and the folks at Health People for several years now. And in our efforts as an organization to address health disparities and to promote health equity, we've been able to do so through education, policy, and advocacy. Previously, Black Health has been able to partner with Health People on our efforts to address health disparities related to diabetes, amputations, and other health disparities related to diabetes health. And so we are excited, tremendously excited, to have Chris Norwood join us this evening to talk a little bit about the efforts that are coming out of Health People and some of the advocacy work that they are doing. So, hi, Chris, how are you?
Well, hi, Shirley, how are you? So nice to see you.
It's great to see you. And so, would you like to tell us a little bit about yourself and about the organization before we jump into the question portion of tonight's interview?
Yes. Originally, Health People started as a women's AIDS peer education program at the height of the epidemic. And women, everybody was having a hard time, but women were really having a hard time. On average, they died within a year of being diagnosed. So I wanted to start a women's program, and many women, despite their horrible situation, they wanted to spend the rest of their time trying to help other people, support them, and prevent AIDS. And when I saw the power of that kind of peer education, we just continued. I asked them what they wanted to do else. And at that time, they said asthma. We started a really major diabetes peer education program, as this epidemic has just exploded and overtaken everything else and had so little government response compared to other things.
Lovely. Thank you for sharing that. And so I'd like you to speak a little bit more to the mission of Health People. I know that the organization's mission is to empower and train residents of communities that are overwhelmed by chronic disease and AIDS, as you mentioned, to become leaders and educators in effectively preventing these disparities. And so, can you talk a little bit about the impacts that you've broadly had, and then also, just how community members have responded to the kinds of models that you're using to spread awareness about these disparities?
Well, our mission is really to enable communities to have the backup, the education and support to start healing themselves, because it's obvious from the situation we face, which is really deplorable. They are overwhelmed by chronic disease, diabetes, and other chronic disease, that we need to have the community take the lead, because public health has not taken the lead. And so the response is really staggering. As I said, when we started, I didn't know if any women would be peer educators. The stigma against AIDS was so huge. And as we've gone along, people just want to start helping their community, helping their family, and helping themselves. So we do very intensive trainings so that the peer educators and peer leaders will have the real knowledge to educate other people in self-care and prevention. And I mean, our results, I would just give a few examples. When we took the diabetes self-management program into homeless shelters, the City Department of Health, they were the evaluators, and they recorded a 45% reduction in emergency room visits among people who took the 6-session diabetes self-management course. We brought down asthma in homeless shelters too. We also do other things to support people. Like one program we have had, it's not as acute anymore, but early in AIDS, it was to help parents and a lot of single mothers make standby guardianship for their children, in case they died, so that the children didn't end up in foster care or homeless. So the peer model is so good, just for many different things that impact communities. It gives people someone who comes from their community, who knows what they're going through, and also knows where the resources are there to be their mentor and helper.
Absolutely. And, at Black Health, we do believe in the power of peer workers and community health workers. It's a model that we implement very successfully as well. And, we've been able to leverage the skill set of community health workers, in areas that include HIV, and especially during COVID. I think COVID really created an opportunity to be able to really bring folks in to support the workforce. And so, yeah, there's a lot of power there in the peer approach and in the community health worker approach.
Yeah, during COVID, Black Health and we and other community groups, I have to say, we did an extraordinary job working together. People really worked together. And the kind of outreach that the community groups were doing, that got thousands and thousands of people to testing. And when the vaccination came out, it got thousands and thousands of people to vaccination sites. And again, that was just a major example of communities working on their own health and being very, very successful. But it doesn't happen that much, as you know.
Absolutely. And, I know that in addition to some of the amazing work that you've already talked about, you all are staunchly committed to diabetes efforts. And I know that November is Diabetes Awareness Month. And so I'd love for you to talk a little bit about, what everyone should know about diabetes, because I think that there are some assumptions that we make about who gets diabetes, what communities are impacted by it. And sometimes we're wrong about those assumptions. And so I'd love for you to share a little bit about what every New Yorker should know about diabetes, and then speak a little bit about, any activities or efforts you have surrounding National Diabetes Awareness Month.
I think what everyone should know is they should have an A1C test, which is a test. It's kind of more encompassing than a test, immediate test of your blood sugar. It tells you what your average blood sugar has been for about 3 months from one test. And that will give you really an important indication of where you are. If you're pre-diabetic, about 25% of people who have diabetes don't know it, even though it's a drastic disease over time. Often it doesn't have really telling symptoms when you first have it. So it's very important to have that test. It should just be part of what people do. The other thing I would like people to know about diabetes is that because we have not focused on teaching people self-management, people under the impression it'll just get worse and worse. Sometimes they don't want to pay attention because they're like, this will be futile. It is not. The British just started a national program to give diabetes reversal counseling across the country because they did a demonstration program. And a third of people actually reversed their diabetes. They got off medications. They got their blood sugar back down to normal. A lot of people can do that. That doesn't mean everybody can. But every effort you make is going to help you. And when you take, especially a self-care course, of which there are not enough, because neither New York City nor New York State, amazingly enough, will actually fund community groups to do self-care education right in their neighborhoods where it's needed. But you will find out, at first it seems so overwhelming and complicated, but you will find out there's lots of easy daily things you could do that will help you stabilize. And if you stabilize, you're really going to be so much better off.
So that's really helpful. You spoke a little bit about the efforts, across the lake in the UK for folks to be able to actually reverse their diabetes. And, I think that that's something that perhaps we don't hear too much about. I think we hear a lot about, you get on your medications and diabetes is something chronic that you live with. It can be controlled, but we don't hear about the part where folks can actually reverse their status, right? They can actually eliminate it.
Heriberto, you want to? My IT person is standing right here. He reversed his diabetes. We have 5 or 6 people in the office who reverse their diabetes. And again, people aren't told you could do that, but you can. And then, as I say, if it turns out that for whatever reason you can't completely reverse your diabetes, you'll bring your blood sugar in control. If this will be very, very helpful. For example, one thing, a lot of this is just totally infuriating because it's so preventable, especially the severe complications like blindness, amputation, and kidney collapse are very, very preventable. And particularly with blindness or vision loss, if you get your blood sugar in good control about, within the first 2 or 3 years after you were diagnosed, then you will almost certainly save your eyesight. The retina is one of the first places in the body to be injured by high blood sugar and scarred behind the retina. But if you get in control as soon as you can after diagnosis, you'll have a really, really good chance that won't happen to you.
And then you alluded to amputations as well. And I know New York City, New York State actually has some pretty high rates of amputations. And so can you speak to some of, Health People's efforts to address the high rates of amputations that we see?
Yes. Do we have the slide, or I don't know, I can hold up. Okay. This is your state. Had 100% increase in amputations while the national rate was going up 57%, which, by the way, the national rate should not have. This is a public health disgrace. We accept it. During all these years, this has been going up. We've had how many health commissioners in the city and state? I have never heard one of them say a word about this or that they are going to make an effort to bring this down. That is so deplorable. I guess if I had a dictionary, I wouldn't find enough words. But people should memorize that. That are your public health departments at work happening to your communities. Black communities have 3 times the amputation rate. We are going to, on November 14th, which is World Diabetes Day, we're going to have a protest on the City Hall steps and demand that New York State start requiring hospitals to have an amputation reduction plan and that it properly regulate the vein centers that you see everywhere, because some of them are very helpful, but others of them are horribly exploitative, and they do repeated procedures on people, which actually end up collapsing their veins, their leg veins, which means, the likelihood of them having an amputation is close to 100%. We are very privileged and happy. Dr. Dre, who people may know as a hip hop pioneer, he's from New York. He's a New York one, and former MTV Raps host. He had a typical experience. He didn't know he had diabetes. He didn't feel that bad. He stepped on not a nail, I think a tack in his house. His leg got infected. He thought, oh, this will clear itself up. It didn't. And that's how he found out he had diabetes. But he also had an amputation. So he is going to come on November 14th and lead what he calls a step up, easy exercise that people can do. But he's also going to lead us in spirit to know that we can overcome this and not have to accept this amputation rate. It's going to be great.
Yeah, that's exciting. And so for folks who didn't hear, this is Dre, the former MTV rap DJ, VJ. And so, you know, please tune in and learn as much as you can about these efforts because they impact all of us. If you may not have diabetes and you may not have family members who have diabetes, but I think we all certainly know someone who does and who may be impacted by this. And so, you know, it's a topic that is, I think, important for all of us to be aware. And if you don't need the information for yourself, you can certainly share it with other folks. And so, Chris, can you maybe tell us how folks can get involved with World Diabetes Day or other efforts you have surrounding Diabetes Awareness Month?
Well, you know, they could come down on November 14th to the City Hall steps, but there's a lot of things they could do. And I think what they should do is, it's easy to get, I don't have it with me, the email of the State Health Commissioner and the City Health Commissioner. I can give it to you both. And I think they should inundate them with emails demanding that we have community delivered accessible diabetes self-management education, because that really works. Handling diabetes can be very complex. As I said, it can be daunting. People are just overwhelmed. There's a very high rate of depression among people who have diabetes, and they just start thinking, this is just one more thing. I can't deal with it. But if they have accessible education in their community, that will really help them deal with it. So why won't the state and city pay for that? Look at all the other things they pay for. And this is the most widespread disease. It is the disease that is most destroying communities. You're up to places now, zip codes that have a 20 to 30% rate of diabetes, and there's no education available in that community.
And so why do you think, despite the disparities that are so stark and so blatant around diabetes and diabetes-related disorders, illnesses, or even co-infections, why do you think we don't see our public health systems or governments doing more about diabetes? What do you think the gap is?
I've asked myself that many times. I discuss it very often with C. Virginia Fields. Your leader, your former leader. And we are just painfully baffled. How can this go on? And I think part of it is, to tell you the truth, it's not, I don't know. I don't think exciting is the right word. It's not, you know, like the mental health and drug addiction. We have huge programs and we should for those. And this is a matter of sitting down patiently and properly and respectfully, helping people understand how to manage their disease. And that is something that, you know, requires patience and respect. I'm not sure it clearly it doesn't appeal to the public health authorities. I don't know. The education that's available, and it's also Medicare and Medicaid, they will only pay for education within hospitals or clinical settings. Well, that eliminates a lot of people. If you're not near a hospital or you don't have a bus, in the city, we have pretty good transportation. Upstate New York has some terrible diabetes rates. Those people can't get any education because, you know, there's no buses or subways upstate. They can't get to it. So it seems to be pervasive. And if someone has the final answer for this, I'd really like to know, because I cannot fathom how this is possible.
Yeah, and I would just say that this is one of the reasons why advocacy is so important, because we do see people come out in the thousands and droves to advocate for some of the other health disparities that, you know, health people, you know, talks about, but Black health talks about, right? HIV, hepatitis C, breast cancer, to name a few, right? We see people really advocating, people really disseminating information about these disparities and how they've been impacted. We maybe don't see as much with diabetes, and it may be because I think, you know, there's this perception around diabetes that because it is a chronic disease that can be managed, that maybe it's not as big a deal. And so that sometimes I think impacts how people talk about it and people's response, right? There isn't that immediate urgency that I think people tend to move with when, you know, they don't know about something, right? When COVID happened, there was a sense of urgency because this was something new. It was maybe exciting. And, you know, Chris, you said maybe exciting isn't the right word here, but, you know, it's something new and it's something that people are eager to learn about because of that newness. And so that really drives the sense of urgency that we see. But perhaps because we hear about diabetes so often, people have almost become desensitized to it, not understanding some of the implications like amputations and blindness and loss of vision, right? Not understanding some of those longer term impacts.
I think desensitize is a good word. And I also think that there's, you know, people think, oh, if people with diabetes, you know, if they just gave up a candy bar or whatever. This food is very, very addictive. And you need, like with any other thing that grabs you in an addictive way, to have some support to change it. I mean, the other thing is because we've done so little of what we should do, people haven't seen progress. The public hasn't seen progress, even within the medical systems. I asked the head of a very large medical system once if his system was putting one diabetes self-management program in the community. And he said, no, people don't go to it. I was like, we've seen 2,000 people go to it.
Yeah.
So you have this attitude that people won't go, they don't change, but they do. And again, it depends on how you approach it. When you do programs in the community that are run by the community, people find that very welcoming and they go.
Yeah. And so we're coming towards the end of this session, but I'd love for you to speak about some of the challenges. And you've mentioned quite a few already, but if there are a couple of challenges that, you know, you all are working to navigate, and, you know, what strategies you're looking to use to overcome some of those challenges, and how people can help, right? How folks who are interested can help you do that.
Well, I think it's important to realize, as I said, neither Medicare or Medicaid, which are both going bankrupt substantially because of uncontrolled diabetes, will pay for self-care education in the community that is so well evaluated that brings down costs almost immediately at the same time that it improves health. This is one of our few totally proven ways to bring down costs while improving health. And I think, I mean, we are very focused on having Medicaid and Medicare pay for this. And, you know, when they all say, oh, we're going bankrupt, what can we do? What they can do is see that people are healthier. And that will save billions of dollars.
Absolutely. I mean, our country, you know, when we compare it to other wealthy nations, is almost ranking very low, right? Very low on most of these the health outcomes, just because I think we have a tendency to pour billions of dollars into treatment, but not as much into prevention. And I think this is why public health is so important. And, you know,
it is important.
More and more, I think, you know, we're trying to think of ways to engage our communities in discussions about public health, because public health for so long has kind of been behind the scenes, right? And, you know, I was at the American Public Health Association conference this past week, and on one of the panels, I heard someone say, you know, it's easy to measure treatment, right? It's easy to collect data on individuals or on communities that are sick, but when people aren't sick yet, maybe there isn't, again, this sense of urgency to collect data on them, and therefore we tend to see folks putting their investments into treatment and not into prevention. And so, that's something that I think as a nation, we really ought to think about and strategize around is, how can we get better at public health and get better at prevention in general? So I appreciate that point that you brought up.
Well, I just want to say that working with Black Health is really good, and we'll get someplace.
Absolutely. We're certainly great fans of Health People too, and have enjoyed our partnership tremendously. And, not only have we been able to work with community members, but we've worked with students, right? And so what better way than to get future health professionals started on this work very early, through internships, through health equity summits, which we've partnered on, and getting them to understand the power of advocacy and the power of having their voices heard early on. And so we're excited, and we definitely are looking forward to November 14th. Just in general, if folks want to learn more about Health People and the work that you all are doing, what's the best way to either connect with you or to connect with the organization?
You can go on our website, which is www.healthpeople, one word, healthpeople.org.
Awesome. Thank you. And so as we wrap up, as always, we're so thankful for, the information, the knowledge that you've shared with us this evening. You can reach out directly to Black Health for more information about this topic of diabetes, as well as other health disparities, by visiting our website, which is www.nblch.org. You can also follow us on Instagram. Our handle is National NATL Black Health. So NATLBLACK Health, all one word, on Instagram. We look forward to continuing these discussions and, hope that you reach out and share your thoughts about this episode. Thank you.